Welcome back to Let's Learn English. I'm Jessica.
And I'm Daniel. It is great to be here with all of you again.
It really is. So, Daniel, today we're tackling a topic that, well, let's be honest, nobody really likes it, but it's super, super important.
Uh-oh, this sounds serious. I feel like you're about to say taxes or, I don't know, public speaking.
Haha, no, not that serious, but close. We're talking about going to the doctor or the dentist.
Ah, okay, yes, a necessary evil. I actually had to go for a checkup last week, and it got me thinking. It's already a bit stressful for native speakers, so I can only imagine how tough it can be if you're trying to navigate it in a new language.
Exactly. You're trying to understand what they're saying, but you're also worried about your health. It's a lot. So, we thought we'd break it down, go over some useful vocabulary and phrases to make the whole experience, well, a little less painful. No pun intended.
Pun definitely intended. All right, so where should we start? The first step, I guess.
The first step. So, you have to get your foot in the door. You have to make the appointment, which usually means a phone call.
The phone call. That can be the most nerve-wracking part for a lot of learners. What if you don't understand them or they speak too fast?
Totally. And it's okay to say that. You can always say, I'm sorry, I'm learning English. Could you please speak a little more slowly? Or could you say that again, please? They will understand.
That's a great point. Don't be afraid to ask. Okay, so what's the key phrase we need to start the call?
So you can say, Hi, I'd like to make an appointment, or I'd like to schedule an appointment. They both mean the same thing.
Okay, let's try a role play. You be the receptionist at the doctor's office and I'll be the patient calling in.
I love it. Okay, ring, ring. Doctor's office, this is Jessica speaking. How can I help you?
Hi. Yes, I would like to make an appointment to see Dr. Evans, please.
Certainly. Is this for a general checkup or are you experiencing any particular symptoms?
I'm not feeling very well. I have a sore throat and a bit of a fever.
I'm sorry to hear that. Let me check the doctor's schedule. It looks like we have an opening tomorrow at 10:30 in the morning or on Friday afternoon at 2 p.m.
Tomorrow at 10:30 would be great. Thank you.
Perfect. Have you been to our clinic before?
No, this is my first time.
All right. We'll need you to come in about 15 minutes early to fill out some paperwork. Also, could you tell me what kind of insurance you have?
Ah, insurance, the big one. What if I don't know the exact name or details?
That's totally fine. You can just say, I'm not sure, but I can bring my insurance card with me. They'll usually say that's perfect.
Okay, cool. So I survived the phone call. I'm at the office. What's next?
Okay, you walk up to the front desk, the receptionist, and you check in. You just say, Hi, I have a 10:30 appointment with Dr. Evans. My name is Jessica.
And then the paperwork, my favorite part.
Ugh, the worst. You'll probably have to fill out some forms. It's usually about your medical history, any past illnesses, allergies, things like that.
Right. And after you finish the forms, you go to the waiting room and you wait.
Eventually, a nurse will call your name. The nurse usually takes you back to a small room and checks your vitals, like your temperature and blood pressure, before the doctor even comes in.
Okay, so the doctor finally arrives. How do you start describing what's wrong? This is where the real vocabulary test begins.
My best advice is to keep it simple. I once tried to use a fancy word I looked up for dizzy, and the doctor just stared at me. It was so embarrassing.
No way. What was the word?
I think it was vertigo, but I said it wrong. I should have just said, I feel dizzy or the room is spinning. Simple is better.
That is a really good lesson. So, simple words: headache, fever, cough, runny nose, sore throat. What about the difference between an ache and a pain? That can be tricky.
Great question. Generally, an ache is a dull, constant feeling, like a stomach ache or a headache. A pain is usually sharper and more intense.
So, you could have a toothache but feel a sharp pain if you bite down on something hard.
That's a perfect example. So you describe your symptoms, the doctor examines you, and then they might give you a prescription.
Which is the piece of paper you take to the pharmacy or drugstore to get your medicine.
Exactly. Once you have your prescription, you head to the pharmacy, and believe it or not, the pharmacy has its own set of communication challenges.
Okay, ready to switch gears to the place of nightmares, the dentist?
Oh boy, the dentist. I had a dentist once who hummed while he worked. It was very unnerving.
That's so weird. I would not like that.
The vocabulary is pretty similar. You still make an appointment for a checkup and a cleaning.
Right. The cleaning is usually done by the dental hygienist.
Yep. But what if you have a problem? The most common issue is probably a cavity, which is a little hole in your tooth.
Right. So you tell the dentist, I have a toothache. Or another good phrase is, my tooth is sensitive to cold.
Ooh, sensitive is a great word to know. So they'll probably take an x-ray, which is a picture of your teeth, and if it is a cavity, you'll need a filling.
And what about that really scary one?
A root canal? Shh, let's not scare our listeners. That's for a much more serious problem. Let's stick to the basics.
Fair enough. But no matter why you're there, you are guaranteed to hear the phrase, open wide.
Oh, absolutely. Over and over again. It just means open your mouth as wide as you can.
Well, I think that's a lot of really useful stuff. Should we do a quick recap of the most important words?
Let's do it. For the phone call, remember make an appointment and symptoms.
When you get to the doctor's office, you'll check in and fill out forms. Then you'll describe your ache or pain.
And you might leave with a prescription to take to the pharmacy.
And for the dentist, you'll have a checkup and a cleaning, and you hope you don't have a cavity that needs a filling.
That about covers it. Our best advice is to practice and prepare. A little preparation goes a long way. Maybe write down your symptoms before you go.
That's a great tip. Well, that's all the time we have for today. Thanks so much for listening to Let's Learn English.
Join us next time when we'll be talking about something a little more fun.
Much more fun. Bye for now.
Bye, everyone.